Our listener writes in, "Hey doc, quick question. How do I find a good primary care physician?" This one comes up all the time, and honestly, finding a primary care doctor is kind of like dating. There are plenty of options, some look great on paper, but you don't really know if it's a fit until you actually meet. Even when I'm seeing patients in an orthopedic setting, people will ask me, "Hey, do you know a good primary care doctor?" Or we'll be managing something and I'll say, "This isn't really orthopedic, you should see your primary care." And they say, "I don't have one, how do I find a good one?" So today I'm going to give you 5 practical tips to help you with that primary care physician search. I'm Dr. Jeremy Alland, sports medicine physician, team physician for the Chicago Bulls, and this is Hey Doc, Quick Question, the podcast that's dedicated to answering your health questions in a short amount of time. I'll be back right after this break. So I promised 5 practical tips to help you find a primary care physician. Let's start with tip number 1. This one's kind of boring, but it's super important. You got to find out who takes your insurance. Now, it's not actually that difficult to find who takes your insurance. You just go to your insurance carrier's website, you put in your zip code and hit primary care, and usually it'll give you a long list of people that you can see who take your insurance. It's super important that they're considered in-network, and that's because they have a relationship with your insurance company that's going to keep your costs down, keep the doctor's costs down, and make it so you can access them much easier than if it's an out-of-network provider. Now, I promise you, this list is going to be long, and it's not going to help us find that primary care physician that's right for you, but it's a good starter list because now we know everybody takes your insurance. Let's get to tip number 2. The most powerful recommendation you can get for a primary care physician is from people you know and trust already. Ask around. Many of your friends and family already have a primary care physician, and I promise you, if they love them, they're going to tell you about it. How many times have you heard, "Oh, I love my doctor," or maybe you've heard, "I don't love my doctor." But for the ones who love them, they're happy to tell you about them. And as a physician myself, anytime I get a referral where the patient says, "Yeah, a patient of yours told me to come see you," that's a huge compliment. It means that I'm doing something right because they went out on a ledge to a friend or family member and said, "You definitely got to see that doctor." So when you decide to ask your friends and family, don't just ask, "Do you really like your doctor?" but also ask for things like, do they listen? Do they explain things clearly? Do they make you feel like a human and not just a chart? If someone has similar health needs to you, bonus points, because they're probably going to be able to handle you in a very similar way. And some primary care physicians also take a special interest in things, such as some primary care doctors do sports medicine, but not full-time like me. And so you may find out, yeah, that person has a special interest in women's health, and I'm a woman. That sounds great for me. So tip number 2, ask the people you already trust. Tip number 3. Don't get catfished by the ratings. Ratings of doctors, and trust me, I know this all too well, are incredibly fickle. I want you to think for a second, where would I go find a rating on my doctor? I'm not sure if anything really comes to mind, but if you do Google a doctor, such as myself, right now, you'll see that there's Google reviews as well as other websites that are dedicated to reviewing physicians. Also, with the organization that the physician works for, they'll have rating systems from the feedback forms that they give patients. And many times these ratings are incredibly biased to the people who are willing to take the time and fill them out. When I was early in my career, it was recommended to me to ask patients who were having a good experience to go leave me a review, because the more good reviews I got, the less a single negative review would affect my overall star rating. And it's kind of crazy. But when you do the search and you look for a doctor and you see they're 3.5 out of 5 stars, how many of you click in and actually read the rest of the reviews versus saying, "I don't know if I want 3.5 out of 5 stars. I've seen negative reviews for the parking was bad or the waiting room was dirty. Is that really reviewing the doctor? I mean, it's part of the experience, but I'm not sure that tells you whether they're a good primary care doctor or not. For me, when I'm checking out a new physician, I only put stock into those star grades if I see over 100 reviews, ideally over 500 reviews. Because in that case, I know I'm getting a large sample size, enough to tell me, this is around where that physician should be. And I also try to read through a bunch of them to get a sense of what most people are commenting on. You'll see things like, they spend the time, they're willing to listen, their staff is so nice, or I didn't feel like I had time in the appointment to get out what I wanted. The doctor spent the whole time looking at the computer. These are all little things, little hints that can tell you, is this person for me or not for me? But the ratings are not everything. All right, we have a list of in-network physicians. We've asked around to our friends and family. We're not going to put too much stock in the reviews. Tip 4, you can do a little background check. This is where it gets a little dicey because how do you know what's good and bad? I'm going to give you a little insight to my thinking. You can go to the doctor's website and they'll have a profile. And if they're part of a bigger system, it'll be on the hospital's page. And there it'll say where they went to medical school, where they did their residency training, did they have any fellowship training? And from that, you can make your own judgments on whether those are quality institutions or not. My own personal opinion, you can't really tell if somebody's a good doctor based on what school they went to. More powerful on these pages is there'll be a little section for a bio. And you can tell if this bio has been written with the doctor's input or if it's just a cold cut from the hospital system, because it'll have little things about interests or areas of expertise or something from their background that is special to them. In addition, a lot of them have been putting out videos where they say something important to them about patient care or why they went into medicine. And you can get a sense from that conversation of, does this person's priorities match with mine? I'll give you an example. I'm a non-operative sports medicine doctor, which means I don't do surgery. And on my page, there's a lot of featured text that says, I don't want people to have surgery. Also on my page is a video in which they asked me questions about how I treat patients, of which I put out, I want to give you all the time. I want you to feel heard. In addition, I want to make sure that you're not going to have surgery if you don't need to. So a lot of patients who come and see me in the office who weren't directly referred will say, you know what stood out to me about you, Dr. Alland? You want to keep people away from surgery, and I don't want to have surgery. I'm so happy to be seeing a non-surgeon. So it gives you an example of, if the primary care physician says, I'm a specialist in women's health, I believe in trying to make sure that women are aging appropriately and we are getting in the way of issues like osteoporosis or menopause, and those are important topics for you, that may be a good fit. Whereas if you're a 60-year-old man, that may not be the best physician for you. I want to briefly comment on also finding an appointment. Sometimes the most popular providers can be very difficult to get in with. And so you have to decide, am I willing to wait 6 or 8 months to see a primary care physician, or do I want to see somebody sooner? And as the person who can see me sooner, does that make them a worse physician? If somebody has open availability sooner than another person, does not mean that one is a good doctor and one is a bad doctor. It just means that that person may be newer to the practice and therefore doesn't have as built up amount of patients. It may mean that that person had a change in their schedule and it opened it up. I think it's okay to take an earlier appointment with somebody, because this gets to tip 5, and realistically where the meat of this is, the first visit is the real test. The truth is, you're not going to really know until you go. In addition to that first visit being an opportunity to have your health addressed, it's also an opportunity to say, is this the right person for me? Did they listen? Did you feel comfortable? Did they explain things in a way that made sense? Did they make it feel like even if it was a short amount of time, it was your time and they had nowhere else to be? I think this is the most important part of this episode. If the answer is no, it's okay to switch. So many people won't change doctors even though they don't like the one they're going to. And I'll oftentimes hear, I don't want to hurt their feelings, or it just was so much effort to switch. And I get that, but if you don't like your primary care physician, you're not going to be encouraged to go, which means that you're not going to be telling them everything that's going on in your health, which means you're not getting the most out of those appointments. It's not personal. It's your health. The doctor's not going to be upset if you go see somebody else. In fact, most of the time, we don't even know that you went to see somebody else. Think about it with other fields. If you went and brought your car in and you had a poor experience with a mechanic, you're probably not going to bring it back to that same mechanic. If you had somebody come out to do work on your house, and the work on your house was poor, or you didn't like the person, you're probably not going to invite that person back. It's no different with your doctor, and maybe even more important because you're confiding in them very personal details about your life. If you're not comfortable, it's not going to go well. And if you want to look at it with a silver lining, you may have learned something about yourself when you went to that appointment about what you like in a primary care doctor, what you don't like, and it may help with the next search. So you may not like it, but the best way to find a good primary care doctor is to keep seeing them until you found the right person. And I'd be remiss if I didn't bring up concierge care at this point, because I think there's probably a few of you who are listening who said, I loved my doctor, and then they went concierge. Concierge care is a whole separate episode, and I'm happy to answer these questions, but the short version is this is about time and resources. Primary care physicians are paid some of the lowest salaries in all of medicine, and they're asked to cover the widest breadth of medicine. and oftentimes have panels that are super, super, super big when they're not concierge, and so they can't give the personal care that they sought out to do when they went into primary care. So by going concierge, they can decrease the amount of patients they're seeing overall and therefore give more independent time, and it's usually a win-win on both sides. The patient gets more time and value, and the doctor actually feels like they're doing the medicine that they sought when they went to medical school. The problem is it comes behind a pay window, and not everybody can afford this. But as I said, this is going to be a separate episode. I can't talk about all of concierge care here. My advice to you, if you have a great doctor who's going concierge, set up an appointment so that you're face-to-face with that doctor and ask them directly, which doctor would they recommend you see once your doctor leaves? Why do I recommend being face-to-face to get that recommendation? I think when you're going through portal systems or through staff, the doctor may not 100% remember who you are. They remember some things around the edges, but you really want them to say, oh, I remember this person. I've seen them a lot. You know who you do well with, and get that direct referral from that doctor. A good doctor, which you've said you love this doctor, will try to hand you off to someone they trust. And that's definitely the best way to get a new primary care physician in this situation. So in summary, 5 steps and a bonus. 1, start with your insurance. 2, ask around to friends and family. 3, don't get too hung up on ratings. 4, do a little background check, whether it be based on education or special interests. Listen to their videos and check out their testimonials. And 5, go to that first visit, and if it's not for you, keep searching. Don't get stuck on one doctor that is not working out for you. Finding a primary care physician can be very, very challenging, but when you find the right one, it is worth it. It has been shown to make people healthier and live longer lives. And when you think about all the time and effort you put into other parts of your life, trying to find the right thing or the right product or the right gym, it may not even be as valuable as finding the right primary care. This person's not just someone who's going to treat you when you're sick or prescribe you medications. They're your guide, they're your health quarterback, they're your partner in life for the long run. I want to thank Maria for sending in this question. Many of the listeners I know have had very similar frustrating experiences finding a primary care physician, and I'm so happy that we were able to address it on this episode. If you could do me a favor, if you found this episode helpful, please share it with one friend who's been shopping around for their own doctor. And if you've got a health question that you want me to tackle, head to heydocquickquestion.com and send it on over. I can't wait to answer them in the future. Once again, I'm Dr. Jeremy Alland, sports medicine physician, team physician for the Chicago Bulls. This is Hey Doc Quick Question, the podcast dedicated to answering your questions in a short amount of time. I'll see you next week. Hey, you made it to the end. Great. Now the legal stuff. This podcast is for educational purposes only. It's not medical advice, and listening doesn't make me your doctor. I mean, I like you, but we don't have that kind of relationship. So please, don't use this podcast to diagnose yourself or to treat other people. Always talk to your actual doctor or healthcare provider when it comes to your health. Neither I, Dr. Jeremy Alland, any guests, nor Hey Doc Quick Question LLC can be held liable for anything you do or don't do based on what you heard here. In short, this is information, not a prescription. Be smart, stay curious, and talk to your doc. Oh, and hey, send me your questions.